Welcome again, ladies and gentlemen, to the Tom Jones Show. And we have a special guest with us this evening going to tell you all about the Bay Area medical marijuana program in line with some other things that we're doing along the areas of the Tom Jones, all about jazz and more. We want to acquaint you with a lot of activities and things going on in the San Francisco Bay Area and my association with, as I mentioned in another past episode, about the Care Cancer Assistant Research and Education Program, where we're working out of General Hospital, working with people with AIDS, diabetes, hepatitis C, and many other things like that. In association with that, we're working with the Medical Marijuana Project, which we're trying to get promoted not only locally around the country to help people with those illnesses that I just spoke about. And we have with us this evening a Mr. Percy Coleman. I've known Mr. Coleman a number of years here in San Francisco area. He's very familiar. His previous work was with the HUD, Housing and Urban Development Management, and he's done some other things. He's a resource around the city, incorporating many aspects of working with the Medical Marijuana Project. How you doing this evening,
Thank
Mr.
you, Tom.
Coleman?
Thank you
How
for
you
inviting
feel
me.
this
I'm really
evening?
glad to be here.
Yeah.
As you know, the organization that I represent, of course, is the San Francisco Patients Union, a spinoff of the BAM Collective, which has been around since about 2003. And our thing now is that we want to open our organization up. We've been around since 2003, Tom, and basically we've been a pretty closed organization of about 40 people. And the need, the cost of the economy being bad as it is, the cost of marijuana or medicine, and the clubs being as high as it is, we feel there's a need for us to find a way that patients who have little or no income could access their medicine at reasonable prices at least. Ideally, we wish we could just give it all to everyone, but unfortunately that's not possible. But we are trying to do cooperative buying. We're doing collective growing, things like this here. And the organization is starting to um, look for more patients who may want to be a part of this. We're thinking about maybe trying to enlarge our organization to a larger patient group of at least 100 people. And we'll be looking for people to make application. We're looking for basically low-income patients, patients who really can't afford to purchase their medicine at the club prices.
Mm-hmm.
Anyone who can afford to pay $50 an eighth really doesn't need our help in order to get their medicine. We're looking for people who are low income, who are disabled, who are seniors, who are terminal, who basically are at the margins of those people who normally are serviced by the clubs. And hopefully we'll be able to find at least 100 in San Francisco, if not 1,000. 100 would be great. Um, we'll open up to any patient who would like to just find out about what we do at the union. We meet the third Wednesday of every month at the Patient Resource Center at 1290 Mission at Ninth. There's also the headquarters of the Axis of Love group. And we're open to any patient who is truly low income and truly needy.
That's wonderful.
Uh-huh.
Myself, I have hepatitis C. Many people don't know what that is, but that's an illness. It's a deterioration, and you have to worry about your kidneys and things, liver and kidneys and things. And I also have prostate cancer. And I find that many people don't know how does marijuana help in a situation. I myself can explain what it does to me.
Well,
But one of the things that I feel the fears of the people is how does it affect children if they legalize marijuana?
hmm.
And how would that affect children? Or how would that affect the whole overall thing? What would be the limits
well,
of the legalization of marijuana?
well, first off, I don't think they would legalize it. We wouldn't want to legalize it for anyone who's not an adult. unless, of course, the doctor would recommend it for them, in which case then we would support that. Uh, our focus is primarily just medical marijuana. We're not so much into legalization. We're into receiving it as a medicine. You got to keep in mind that a lot of people are not aware that man has been using marijuana as a medicine for over 5,000 years. And it's only been in the last 60 or 70 years that it's become illegal or not recognized for its medicinal qualities. And the truth is, I don't think it's because they found better medicine so much as it is that the powers that be had decided that the people who did use it were a bad influence on the general public, and so they outlawed it for that reason. Um, we found that while marijuana doesn't actually cure any illness specifically, it provides relief for pain, from anxiety, from stress, from help you develop an appetite. There are a number of other things that marijuana could do other than just have a psychoactive effect on the body. And for medical marijuana patients, for most people it is for pain relief in some form, or anxiety relief, or to help them relax. And I'd like to say from a personal standpoint, I've always been a rather hyper person. And over the years, even before I knew that it was possible to get it legally, I used it illegally because I needed something to just allow me to just be able to perform normally during the day. Sometimes I'd be running so fast I'd literally burn myself out. Um, like I say, our organization has just been around about 4 years now, 5 years, and primarily we've been kind of a closed organization. We don't buy or sell marijuana for anyone. Basically, we grow our own, and we do everything in-house. We don't look for outside sources for anything. We don't charge any money to the patients. The only money that is contributed is just enough for us to be able to actually grow the marijuana for nutrients, for new products, and stuff like that.
That's very worthwhile. But I've heard that over the years, being in the being an ex-drug addict myself, having used heroin for a number of years, and marijuana also placated me. Even then, it helped me with stress problems. But the big question in my mind, as many people see, they had this anti-marijuana crusade out that when you smoke marijuana, it makes you crazy or silly. What is that? Is that
I think that's kind of a myth that someone has put out about marijuana over the years. Sorry about my phone, kid. Um, I think that's a myth that has been perpetrated when the indoctrination that marijuana wasn't medicine and it was a drug that needed to be avoided because it had no medicinal use. I think that's part of the myth that they started. I don't really believe I've known anybody or anybody can find a case where someone has been smoking marijuana for medicinal use and has went out and done any serial killings or going postal or anything like that. In fact, you probably find that there's probably never been a medically recorded case of death involving marijuana only. You know, I mean, it could be wrong, but I've never heard of it.
I've heard.
Yeah. Another thing I like to say too to a lot of people out there, one of the problems we encountered as people on a fixed income was the fact that the cost of marijuana in the clubs was just prohibitive for any of us to afford high quality medicine or enough to actually ease our illnesses or ease our pains. And so consequently, we became convinced that there had to be a better way to access our medicine. And initially, I believe that Prop 215 law was written for patients to grow their own. And so this is our focus at the moment. We try to find people who can't afford to go to the clubs. We try to cooperatively bring them together, and we grow cooperatively. One of our great hopes is that the city of San Francisco will at some point recognize the need of patients and the fact that they don't have the actual room to provide for their own medicine and allow us the opportunity to have a community grow.